Hi, I'm Dr. Srimukhi. I'm a consultant pediatrician and neonatologist at Vignesh Fertility and Children's Hospital 10 years. So today's topic is regarding tips to avoid monsoon diseases. So what should we do for our children to avoid these monsoon diseases? When the monsoon comes, we are all happy that we have suffered a lot from the scorching heat and all, and now the climate is good, and we think we can enjoy. But this is when most of the diseases start in India uh, because of the humidity and because of the collection of water everywhere and pooling of water. What happens is there are more of waterborne diseases, there are more of mosquito-borne diseases. The contamination of food is also more because of the insects and all lying on the food, and easy spoiling of the food during this season. And also the mosquito-borne diseases also increase during monsoon season. So these four are the diseases which occur in monsoon season. They are waterborne diseases like typhoid, hepatitis A, jaundice, and all, and mosquito-borne diseases like dengue, malaria, and airborne diseases like influenza, and foodborne diseases like food contamination of food. Most of the children we see suffering with diarrhea, loose stools, vomitings, stomach pain, and all. So these are the diseases which commonly occur in this monsoon season. So how do we avoid these diseases for children? That is what I'm going to talk about today. So, what all I have told you, water. So, see that your child drinks safe, clean drinking water. That you can do by boiling the water and filtering the water, or if there is an aquaguard available in the house, see that it is UV, UF, and RO some if required, depending upon the water supply you have. So, see that your child drinks safe, clean drinking water. And the second thing is airborne diseases. So the most common airborne disease in this season is influenza, respiratory syncytial virus, and now the COVID is again back. So COVID. So all these. So for these three diseases, it's always to wear a mask or wear a mask to child whenever he's going into a group to play, and follow hand hygiene, and stay social distancing. At least when anyone is sick, like cold, when the child is suffering from cold, cough, or fever, do not send them to school. And in the same way, maintaining a distance between other children with around 6 feet is important. So masking, hand washing, and social distancing helps in cases of airborne diseases. Third thing is mosquito-borne diseases. The main problem in India is we see pooling of water around in the roads and in around the house and in some places in the corners. See that in your house or in the surroundings of your house, if there is any bucket of water or pooled water present, see that it is taken off. Okay, and if it is unavoidable condition, some we can put some phenol or some gambusia fishes into that pond to prevent the mosquito breeding. Okay. Second thing, when it comes to kids after coming from school, they start going out for playing and all. So to prevent mosquito bite, it is better wear clothes with full hands and full sleeves. So what happens is exposed areas have to be decreased. And if there is an exposed area, apply a mosquito repellent cream. There are many mosquito repellent creams available in the market now, and even you can apply a fabric roll-on. This is nothing but applying that liquid on the fabric to prevent mosquito bite. So these are some measures which can be done when you're sending your child outdoors. And when the child is in indoors, you can the best thing to prevent mosquitoes is mosquito net. If it is not possible, and if the child is not allergic, you can light a mosquito coils and all. So this is how we prevent mosquito-borne diseases. The next thing is foodborne diseases. Decreasing the outside food in your child's diet and giving them fresh homemade food is one way to decrease the food contamination and foodborne diseases like typhoid and hepatitis A. So, coming to all these diseases, there are some vaccines which prevent these diseases. Like there is a vaccine for typhoid, there is a vaccine for hepatitis A, there is a vaccine for influenza. So, consult your pediatrician and get to know if it is required for your child, and get your child vaccinated from these diseases so that your child can stay safe and healthy during this monsoon period. So with this, if there are any questions and question and answers, I can answer some. Okay. First question is, how can I prevent waterborne or cold-borne diseases in my kids during monsoon? That is as per Lavanya. So what can we do to prevent waterborne or foodborne diseases? As I told you previously, see that your child drinks clean, safe drinking water. That is, if you have municipal water supply, boil the water and filter the water is the way. Or if you have an aquaguard supply at home, see that it has UV or UF filtration, and RO system if the ppm at your area is high. So see, drinking safe and clean water is important, and using safe clean water for cooking is also important. So then foodborne diseases. So foodborne diseases can be prevented. Most common foodborne diseases in India are typhoid and hepatitis B. So these diseases can be prevented by giving a vaccination also, like typhoid and hepatitis B vaccines are available. But at home, mostly giving food which is freshly cooked at home is important. Avoid outside food eating, and see that if there are any fruits or vegetables left on the table counter, see that they're covered, because even mosquitoes and insects can spread this typhoid and hepatitis A, B from one place to another. They are all fomites. So these have to be covered. See that the foods are covered, and see that you wash your vegetables and fruits cleanly before giving it to your child. So in this way, we can avoid foodborne and waterborne diseases. So Aparna's question is, hi Aparna, how to prevent cold cough in this season? So uh, firstly, it is very necessary to build the child's immunity before anything else. Like the child have to be ready to fight with any infections. So for building child's immunity, you need to concentrate on four things. First thing is his diet. Give him vitamin C rich diet. And vitamin C is present in foods like oranges, lemons, amla, and all. So try to include these things in your child's diet, and see that he has good protein in his food. Like he eats good protein, and he eats at least three types of vegetables, and two fruits are included in his food. So this gives him a balanced diet. I'm asking you to give your child a balanced diet, which helps to build his immunity. Okay, second thing is concentrate on his sleep. So immunity is not one thing. If you change diet alone, it's not going to change. It have to be a wholesome approach. So it should be like diet, sleep, and you have to concentrate on their mental health, and you have to concentrate on their physical activity. So encourage them to play for at least 1 hour, 45 minutes to 1 hour, and avoid screen time, and encourage them to sleep at least for 8 to 9 hours a day. So, or regularizing your child's schedule is important to build his immunity. Second thing is, I already told you, the most common infection in this season is influenza. So uh, giving influenza vaccination can prevent at least 50% of infections in this season. So I think I have answered your question. Uh, Next question is, I'm a mom of 3 months old. How can I prevent monsoon flu in her? So, as I told you, the same is the answer for this question too. One is influenza vaccination. Second thing is, if following masking, social distancing, and hand hygiene. So, the third thing is building your child's immunity. These three things are the things you have to concentrate. Uh, Third thing, will having medications to treat monsoon flu or disease during pregnancy harm my baby, and how? Yes, during pregnancy, some drugs need to be avoided. So, uh, mostly if you go to a gynecologist or a pediatrician or a general physician for treatment of your flu, they don't forget to tell them that you're lactating mother, so that they give drugs which does not interfere with your feeding or does not interfere with the baby, like there are no side effects or there are no teratogenic effects. So some medications need to be avoided, but consult a doctor and then take a proper prescription. So the next question is, what are the monsoon diseases that I should protect my school going kids from? So there are four things you have to concentrate: foodborne diseases, airborne diseases, waterborne diseases, and mosquito-borne diseases. So you should protect your child from these diseases. Follow whatever I have told you before and get vaccinated for 3 diseases, and you can protect your child during this monsoon season. The next is, hello doctor, these days hand foot mouth diseases are spreading. Is this because of monsoon? What are the symptoms of it? Okay. Nowadays, the tomato fever, also called as hand foot mouth disease, this is caused by a Coxsackie virus. That is one virus which belongs to this chickenpox herpes group of virus. So this virus produces fever and rash, like same as like chickenpox and measles and all those exanthematous fevers diseases. So in this disease, what happens is the child particularly has rash around the mouth and on the buttock area, on the palms and on the soles. So this disease has a particular characteristic lesions on these particular spaces. That is why it is called as hand, foot, and mouth disease. So in this disease, the main complications are mostly fever, high-grade fever spikes. Second thing is severe throat pain, due to which the child can't take liquids or can't take food. So the complication can be dehydration, and child might be fatigue, like child might be lethargic and all because of all this. So whenever you find high-grade fever spikes, and if your child is not tolerating orally well, please consult a pediatrician and admit your child and get the IV fluids properly. So other than that, hand, foot, mouth is not a very dangerous disease. You only thing is you have to identify the dangerous signs early and take to the doctor immediately. And this hand, foot, mouth disease can spread from one child to another child easily. It doesn't spread to adults, but it can spread in children. So it's better to follow hand hygiene and isolation if your child has hand, foot, mouth disease. So last question. Uh, okay, so that's it. These are the questions for this session. And so the takeaway message for moms is, my topic is tips to avoid diseases, monsoon diseases. So monsoon diseases are due to four things. One is air, one is water, one is food, and one is mosquito borne. So follow all prevention measures and get correctly vaccinate your child for diseases like hepatitis A, typhoid, and influenza if needed. According to the age group, consult to the doctor and decide. And Take care of your child and happy monsoons. Enjoy monsoons. Thank you.